Very good evening to all my dear MOS members who have joined for this quiz. It is actually a pan-India quiz. We are sorry for the delay. This is the fifth round robin quiz that has been held, the Clash of the Titans. Those who are the past winners, of course, they are not eligible for prizes, but definitely you will have the, we can participate in the final round. Today is the 100th event of the Maharashtra Ophthalmological Society, and we are lucky to have two great quiz masters with us, Dr. Santosh Bide and Dr. Vardhaman Kankaria. As it is too much of a delay, I'll hand over this thing to Dr. Santosh Bide to start the proceedings. Over to you, Santosh. Wish you all the best to all the winners and the participants who are going to participate into the quiz. Over to you, Santosh.
Yeah, thank you, Dr. Jignesh, President MOS. This is the 100th event in MOS, Clash of the Titans, and it's the 5th MOS quiz round robin league. So before we start, just a minute. Can you see the slide?
Yeah, we can see the slide. Go further.
Yeah.
Yeah, rules.
Before we start the quiz, there are some rules which I will repeat. Anybody can participate, whether you are a MOS member or a non-member. There will be 40 questions. Each question will be given 20 seconds to answer. You can answer when I say, now you start answering. The time starts now. At that time, you start answering the question. Press the correct option followed by save button. Once you save the option, you will not be able to change your option. The assessment is at two levels. One is on correct response, and in case of tie, the fastest finger first. The one who has answered fastest will get the prize. There will be 4 winners. In case of tie, there will be 3 additional questions which will be asked, and contestant with maximum number of correct answers will be qualifying for the prize. Before I ask questions, there is a disclaimer that Quizmaster, sponsors, or MOS is not responsible for any network error or any latency issue or any server issues or any issues beyond the scope of resolution. So all the best to all the participants, and let's start. We start with the first question. In A scan for IOL power calculation, A stands for, the options are A attenuation, B A constant, C amplitude, and D ascending signal. And your time starts now. Sai, time starts now.
Started already.
7 seconds remaining.
Yeah. So there is a time up, and the correct answer is amplitude. So A stands for amplitude. So let's go to question number 2. You can see that there is an iridectomy. So what is this iridectomy known as? Options are A. Akohoshi iridectomy, B. Rado's iridectomy, C. Ando's iridectomy, and D. Sector iridectomy. So your time starts now. Akohoshi iridectomy, Rado's iridectomy, Ando's iridectomy, and sector iridectomy. So time up, and the correct answer is C, that is Ando's iridectomy. And almost 76% of people have answered correctly. So now the question number 3 is, what is a typical finding in early stages of acanthamoeba keratitis? What is the typical finding in early stages of acanthamoeba keratitis? Options are A. Radial perineuritis, B. Ring infiltrate, C. Hypopyon, and D. Corneal neovascularization. Now your option starts now. Question number 3. Typical finding in early stages of acanthamoeba keratitis. Is it A, radial perineuritis, B, ring infiltrate, C, hypopyon, or D, corneal neovascularization? And time up, and the answer is radial perineuritis. Very good. I think everybody is answering correctly. Almost 59% of people have answered correctly. Now the next question, question number 4. Cretan protocol is form of A, retinoblastoma treatment, B, collagen cross-linking, C, diabetic retinopathy for laser protocol, and D, vitamin A deficiency treatment. So what is a Cretan protocol form? The time starts now. Cretan protocol is a form of retinoblastoma treatment, collagen cross-linking, diabetic retinopathy, laser protocol, or vitamin A deficiency treatment. And the time up. So the answer is collagen cross-linking, and 77% of people have answered it correctly. Now we come to the 5th question. Which of the following is not a feature of Leber's congenital amaurosis? A, pupillary reflexes are impaired. B, enophthalmos. C, autosomal dominant. And D, retinal dystrophy in infants. Which of the following is not a feature of Leber's congenital amaurosis? Your time starts now. Time up. And the correct answer is, it is not autosomal dominant. So now I request Dr. Vardhaman to ask question number 6.
Thank you, Dr. Bide sir. At the onset, again, I would like to thank Dr. Taswala sir and the team for an invite to be a quiz master, and congratulate him for a historic year and 100th event today. So thank you very much. So now we are going to go to the next questions. So you can see this is the fluorescein angiography of which disorder? Is it a CME, cystoid macular edema? Is it a CSR, central serous retinopathy? Is it a diabetic macular edema, or it is a PFT, okay, which is parafoveal telangiectasia? So out of these 4, which one is this? Your time starts now. So 10 more seconds to go. I think this is a very classic appearance. You should be able to get this. I think even Vanilla knows the answer. Okay, come on. Wait.
Time up.
All right.
And
the correct answer is CSR. So I think it is good that almost 61% have got correct answer. This is called as the smokestack appearance, which is very typical. There are 2 appearances, smokestack and the ink blot. All right. We'll go to the next question now. So what is iridectomy? Is it a surgery for DNS? Is it a cosmetic facelift, surgery for nasal polyps, or is it a form of decompression surgery? Okay, so your time starts now. What is iridectomy? Is it a surgery for DNS, cosmetic facelift, surgery for nasal polyps, or it is a form of decompression procedure? It's a very commonly used term. 5 more seconds to go. All right. So the right answer is B, which is cosmetic facelift. And I think a lot of people thought that it is also a form of DNS. No, actually, iridectomy means rhytids is a Greek name for wrinkles. And iridectomy means that you are removing wrinkles by performing a facelift procedure. So this is iridectomy. All right. So next question is, so which of this is an example of what can be called as a mixed astigmatism? I'm not going to read it out. You can see it in front of your screen. And your time starts now. Which of this is example of mixed astigmatism? Very basic optics question. Last 5 seconds to go. And the time is up. And the right answer is C. I think majority people have got it. So whenever the astigmatism is bigger than the spherical error is when you actually can call it as mixed astigmatism. All right. So next question, please. So name this gadget. Is it an Ahmed glaucoma valve? Is this a Zen implant, a glauco shunt, or an express shunt? So which is this gadget? The time starts now. Ahmed glaucoma valve, is it a Zen implant, a glucose shunt, or it is an express shunt? So your time is up. The answer to that is D. It is a express shunt. Vast majority of them have got it correctly, which is 37%. I think you have to buck up because we want at least 80%, 85% to give the right answers. All right. So next question, please. So I think this is something that 100% of us should know, which is what is this? Is this a Malyugin ring? Is this a Okinawa ring? Is this the B.Hess ring, or it is an eye-ring pupillary expander? So what kind of pupillary expansion device do we have? The time has started. 15 seconds to go. I believe many people have used this device. Last 2-3 seconds to go. And your time is up. So the right answer is the B.Hess ring. I'm happy that 70% people have got it. It is a part of proud privilege for us to have Dr. Suven Bhattacharjee, who from India has actually invented this B.Hess ring in his guest room, working hard. And this is actually done us a lot of proud because this has been implanted all over the world now as the option for Malyugin ring, which is more cost effective. So I think for the next questions, we will have Dr. Bidesar taking over.
Very nice going on. Santosh, your voice is not coming properly.
Okay, sorry. So there is one photograph of a gentleman, and he is the pioneer of excimer laser research. So who is this person? Is he Rangaswamy Srinivasan? Is he Manilal Bhaumik? Is he Christopher Lu? Or is he Harris Goldman? Your time starts now. He's a pioneer of excimer laser research. Is he Srinivasan, Manilal Bhaumik, Christopher Lu, or Harris Goldman? 5 seconds remaining. And time up. And the correct answer is Manilal Bhaumik. I think only 18% of the people could identify it. It was a googly, I think. The next question is Copernicus, Galileo, cruise studies, where all of which are used for which condition? Optic neuritis, diabetic retinopathy, retinal vein occlusion, or open-angle glaucoma. These are different studies, Copernicus, Galileo, and cruise. And they are done for which condition? Optic neuritis, diabetic retinopathy, retinal vein occlusion, and open-angle glaucoma. Your time starts now. Okay, time up. And the correct answer is retinal vein occlusion, C. And almost 62% of the people have answered correctly. Very good. The next question is, who is this German-American eye surgeon who is an inventor? He has established animal model for retinal detachment, and he belongs to alma mater of my co-anchor, Dr. Vardhaman. So who is this German-American eye surgeon? Is he Robert McKemmer? Is he Harry Flynn? Is he Lawrence Januzzi? Or is he Steve Charles? Your time starts now. He's a German-American eye surgeon who is an inventor. And he has worked on retinal detachment. And he belongs to alma mater of Vardhaman. Time up. And the correct answer is Robert McKemmer. Very good. Almost 70% of the people have identified it. Excellent. So the next question is oil droplet, crystalline, and snowflake. These are different types of cataract. These are seen characteristics of which diseases respectively? Whether option A is diabetes, myotonic dystrophy, and galactosemia. You can see the other option B, myotonic dystrophy, galactosemia, and diabetes. Galactosemia, diabetes, and myotonic dystrophy. And option D is galactosemia, myotonic dystrophy, and diabetes. So there are 3 different types of cataracts and they are seen in which type of diseases. Your time starts now. Five seconds remaining. And the correct answer is option D, galactosemia, myotonic dystrophy, and diabetes. Again, almost more than 60% of the people have answered correctly. So we come to the 15th question. It's quite easy. He is the king of crime, a legendary author, and an ophthalmologist. Who is this gentleman? Option A is Arthur Conan Doyle. Option B is Sidney Sheldon. Option C is Arthur Hailey. And option D is Dan Brown. Your time starts now. He's the king of crime, a legendary author, and an ophthalmologist. Who is he? Time up. And the correct answer is Sir Arthur Conan Doyle. Some people have missed it. So now over to you, Vardhaman.
Yes, thank you, sir. So we'll go to the next question now. So this is a very basic test, which is a head tilt test. So we use this to detect paralysis of cyclovertical muscles. So this head tilt test it goes by whose name? Is it a modified Krimsky's test, Hess's test, a Baumgartner's test, or a Beilschowsky's test? So the time starts now. So this is, I think, one of the quickest and very interesting tests to find out which cyclovertical muscle is involved. You have another 5 seconds to go. And the time is up. So let's see how many people have got it. Vast majority, 88%. I think that has been the probably highest score so far. So well done. Next question. So he is father of LASIK. We all know him. He's Professor Palikaris. And we want to know what else has he done? What else has he invented apart from LASIK surgery? So A, he has invented eye tracy technology. B, he has invented corneal inlay. C, he is the father of topography also. Or D, he is the father of femtopenetrating keratoplasty. So what has Professor Ioannis Palikaris invented apart from LASIK? So your time starts now. He is one of the best and the brightest minds that we had in this century in ophthalmology, historic figure, and my mentor has given a lot of inventions which has changed the way we treat both refractive and corneal procedures. And the answer for a vast majority is actually wrong. Majority have actually clicked on invented corneal inlays, which is not the truth. Corneal inlays were actually, vast majority of that was invented, and a lot of work was done by Colombian surgeon. And Professor Palikares has actually invented iTracy technology. iTracy technology is the technology that we use to look at aberrations as a whole, intraocular aberrations versus the corneal aberrations. So he actually performed this activity with the help of a very big spaces agency, and this was invented about more than 20 years ago. All right, so next question, please. So this is interesting, that topical anesthesia that we all boast about, that our cataract surgeries are topical, right? But how many of you know that this was first tried in 1884 to do a topical cataract surgery? And who was that surgeon? Was it von Graefe? Was it Elschnig? Was it Arruga? Or was it Koller? So who was the clinician who introduced topical anesthesia in cataract surgery for the first time in 1884? 15 more seconds to go. 10 more seconds to go. 5 more seconds to go. And your time is up. So the topical anesthesia that we all boast about was actually done first time in 1884 by Koller. And if you will be surprised, what he used as the topical agent for cataract surgery was cocaine. So used cocaine as the topical agent back in 1884. Yes. So next question, please. Miyata grading system is used to grade what? Is it cataract, retinoblastoma, retinopathy of prematurity, or glistenings of the lenses? So the time starts now. The Miyata grading system is used to grade cataracts, retinoblastoma, ROP, or IOL glistening. So there is a lot of buzz about Mr. Miyata and his grading system in the last, I think, 3 to 4 years now. So the time is up. And the answer is IOL glistening, and vast majority of them actually have given the right answer, which is 71%. All right, very good. Excellent. All right, so we'll go to the next question. That this US ophthalmologist, he invented cryo in 60s. All right, so in 1960s, he invented cryo. He used to be a brilliant saxophone player. He died of lung cancer. Who is he? Is it Amoils? Is it Charles Kelman, Charles Stephens, or Steve Charles? So I think it has to be one of the Charles, right? So because there are 3 Charles in the options. So let's see who gets it right. 15 seconds to go. Is it Amoils, Charles Kelman, Charles Stephens, or Steve Charles? So he invented cryo in 60s. Who is this gentleman? The time is up. The poll is locked. And the answers are in front of you. It is Charles Kelman. I think vast majority have got it. A lot of people have actually also written Charles Stephens. Charles Stephens is actually the pioneer of retina, as we all know, one of the forefathers of retinal detachment surgery. And Charles Kelman, who invented phaco, also invented cryo. I think many people don't know that he also invented cryo and was a brilliant musician as well. So for the next set of questions, I would like to invite Dr. Bide sir.
Fantastic going on between both of you, Vardhaman and Santosh. Very nicely framed questions and good options also. So over to you, Santosh.
Yeah.
Thank you, sir.
So we are at the halfway mark. 20 questions are over and 20 to go. So buck up and let's go. So here is another question. Which is the first full-fledged online virtual ophthalmic conference in India? Was it Delhi Ophthalmic Society in 2020? Was it MOSCON in 2020? Was it Uttar Pradesh Society Association in 2020? Or was it All India Ophthalmic Society, which was done online in 2020? And your option starts now. Which was the first online virtual ophthalmic conference in India? Delhi, Maharashtra, Uttar Pradesh, or All India? And your time is up. And the answer is B, MOSCON. And good, 54% of the people have answered it correctly. The next question. Which of the following psychoactive substance can lower intraocular pressure? There are different psychoactive substances. Which one can lower intraocular pressure? Option A is LSD. Option B is amphetamine. Option C is heroin. And option D is marijuana. Time starts now. Time up. And the correct answer is marijuana. The next question is, identify the line pointed by this arrow. Your time starts now. Please start the timer. Option A is Stalker's line, B is Sampolesi's line, C is She's line, and D is Art's line. And there is time up. And the answer is Sampolesi's line. Very good. 75% of this thing have answered. The next question. Which one of the following is choroidal rupture? You can see all 4 pictures and answer. A, B, C, D. Your time starts now. There are 4 fundus images. Which one of them is a choroidal rupture? Next question. The answer is choroidal rupture. 61% have answered correctly. Now, he is the father of corneal cross-linking. What else he has done? Has he performed epilastic, PRK, DALK, or intacs? The time starts now. Please start the timer. Please start the timer as soon as the question is flashed, because there is some issue with this PPT. Your time is up, and the correct answer is he has also performed PRK. So over to you, Vardhaman.
Thank you, sir. So I think a lot of people have actually said he performed the first epilastic. First epilastic again was performed by Professor Palikaris. So nice. Yes. Yes, sir. Thank you.
Next question, and please start the timer immediately.
So identify this suture. I'm showing you this by the cursor. Me and Dr. Bideswar both are showing you. This is the suture which goes in this circle. Is this the Featheros suture, Palikaris suture, Lasso suture, or Marshall's suture? Okay, so you have 5 more seconds to go. Which suture is this? So the time is up. And the answer is Lasso suture. I think majority of them have, a lot of people have got it. Many people have said it is Palikaris suture, which is wrong. It is Lasso suture, which is done for RK gaping incisions, because when there is a progressive hyperopic shift, if you do the Lasso suture, you can actually treat progressive hyperopic shift in RK patients. Okay, so next question is, so Dua's layer is between epithelium and Bowman's layer? Is it between endothelium and Descemet's layer? Is it important in big bubble technique, or it is present in mid stroma? The time starts now. We all know Professor Harminder Dua. Again, he is a pride of India who has studied in Nagpur and has discovered the 6th layer, changed the history of corneal pathology. So which one is the right answer? So poll is locked. And the answer is, it is important in big bubble technique. I think a lot of people have said that it is between endothelium and Descemet's, which is not right. It is actually between the Descemet's and the posterior stroma. Okay, that is the location. That's why it is used in big bubble technique. All right, so big bubble technique is the right answer. All right, next question, please. So this is a very interesting phenomenon. I think the one that you see on the left side that I'm showing with the cursor is when this patient is looking into is light adapted, and the one which is on the right side is when the patient is dark adapted for a long time. So which this Mizio-Nakamura phenomenon is seen in which disease? Is it Oguchu's disease, Stargardt's disease, Gyrate atrophy, or retinitis pigmentosa? Very, very classic finding, which is called as a sun glow fundus photograph. When you do the fundus photography of this patient, Mizio-Nakamura phenomenon. So which disease are we talking about? So the time is up. Here we are talking about Oguchi's disease, and I think vast majority of them have got it. Oguchi's is a form of stationary childhood blindness, and it is basically a very classic thing that you see like a yellow snow glow fundus, and that is basically because whenever you have sunlight, the rods are overstimulated, and there is a lot of potassium which gets released in the extracellular matrix, and this is what gives rise to such an appearance. All right, so we'll go to the next question. So Schill's ulcer, we all know Schill's ulcer is seen in flectinular conjunctivitis, spring catarrh, also known as VKC, herpetic keratitis, or fungal keratitis. I think it's a very straightforward question, probably one of the easiest questions in our series. I hope 100% people get it this time. Schill's ulcer is seen in which disorder? We have 10 more seconds to go. Let's strive for more than 90%. I believe we can do it. The poll is locked, and the answer is VKC or spring catarrh. Yes, so we are at 89%. Excellent. Absolutely wonderful work. So we'll go to the next question. Which of the following is true about pterygium? The probe can be inserted underneath the pterygium at the limbus. It is associated with exposure of infrared radiations. Does the bare sclera technique has 30 to 80% recurrence, or it is a elastotic degeneration? So which of the following is true? Your time has started. So 15 more seconds to go. Okay, those who have answered can say hello to Vanilla.
I think Vanilla is also learning ophthalmology.
So the answer is bare sclera technique, which is seen in 30 to 80% recurrence. That's the reason that we now do claw, correct? Right. So we'll go to the next question. Okay, now I would like to invite Dr. Bide sir for the next set of questions. Yeah.
Thank you, Vardhaman. So 75% of the quiz is over. Still 25% remaining.
Yeah.
So let's go. Question number 31. Basic question. KF ring is seen due to option A is deposition of copper in Bowman's membrane, deposition of copper in stroma, deposition of copper in epithelium, deposition of copper in Descemet's membrane, and all of the above. So if you have any question mark, then you can write down all of the above. Your time starts now. KF ring. Five seconds remaining. And time up. And the correct answer is deposition of copper in peripheral Descemet's membrane. Very good. 75% of this thing have answered correctly. The next question. Fleischer's ring. It is seen in keratoconus at deep epithelial level due to deposition of iron. Again seen in keratoconus at deep epithelial level due to deposition of copper. Seen in keratoconus at endothelial level due to deposition of iron. Seen at endothelium due to deposition of copper, or none of the above. So your time starts now. So iron and copper is getting deposited in cornea, either at the epithelial level or at the endothelial. So it may not be seen in keratoconus also, we don't know. So the correct answer is, it is seen in keratoconus due to deposition of iron at the deep epithelial level encircling the base of the cone. Very good. The next question. If you look at the histology of pterygium, it is elastotic degeneration, epithelial inclusion bodies, precancerous changes, or it is squamous metaplasia of the epithelium. Your time starts now. Histology of pterygium. 5 seconds remaining. Question number 33, 7 to go. Okay, so histology of pterygium is elastotic degeneration. Very good. So the next question. Modified osteoodontokeratoprosthesis has been invented by which surgeon? Dr. Falcinelli, Dr. Gulapalli Rao, Dr. Mellis, or Dr. Anwar? Your time starts now. It's a modified osteoodontokeratoprosthesis and it was invented by which surgeon? Time starts now. Five seconds remaining. And the correct answer is Dr. Falcinelli. Very good. So the next question. Identify the pathology. This is the pathology. You can see the slit lamp picture. So the options are whether it is a traumatic cataract or is it post-phakic IOL anterior subcapsular cataract or is it anterior dislocation of phakic IOL or it is an interface haze in the piggyback IOL. Your time starts now. It's a slit lamp photograph. So please identify the pathology. It's a straightforward question actually. And the answer is, it's a post-phakic IOL anterior subcapsular cataract. Very good. Almost 44% of the attendants have answered correctly. So over to you, Vardhaman, for last and final 5 questions.
Thank you, sir. Thank you so much. I think
all the best, all the 22 participants were there. We wish 4 prizes will be won by the best of the candidates. Over to you, Vardhaman.
Yes, thank you, sir. Your last chance now to do your best. All right. So we'll go to the next question, please. So the tear lens power of 0.05 millimeter is equal to how many diopters? The tear lens power of 0.05 millimeter is equal to 0.25 diopter, 0.05 diopter, 1 diopter, or 1.50 diopters. What is the power, refractive power for the tear lens of 0.05 millimeters? 15 seconds to go. You have 10 more seconds to go. 5 last seconds to go.
I think there should have been 0 diopter as an option.
Should have also had a 0 diopter as an option. So the answer is 0.25 diopter. I think a majority of them have got it, which is 50%. We'll go to the next question. The protocol in the name of this city, the city which is basically encircled, I'll probably read it out to you. It's called as Dresden. So the protocol in the name of this city is followed in treatment of which disease? Is the Dresden protocol is for optic neuritis, for intermediate uveitis treatment, for treatment of ARMD, or treatment of keratoconus? So the time has started. So this is a small city in Germany, which has changed the way we treat this disease since long time. The first time this was performed was in late 1990s, even before 2000s. And this has changed the way we treat the disease of keratoconus. So this is the Polish lock now. And I think vast majority of you have got it, which is 74%. And of course, Professor Spalls, Professor Theo Zeiler, Farhad Hafizi, all the team has done a lot of work. And this has actually has resulted in decrease in the need of corneal transplants for the keratoconus patients in a quantitative manner. There are a lot of studies which are already published that the need for corneal transplants, and as an indication as keratoconus, as corneal transplant has also dropped significantly. So I think it is a great invention. So we all use this scan, which is called as a pentacam scan, right? So this is a tomography which works on this principle where three planes, which are not parallel, but they intersect with each other at a line. So name of this plane or the line where all three of them are intersecting, is it called as the Scheiner's line, Schlein-Klux line, Zernike's line, or Michels's line? So the time has started. So this is, again, I will say, extremely straightforward. I hope that we crossed 90% now. We had reached 89% in one of the previous questions. At least once I would like to see that it has crossed 90%. Let's hope. All right. So yes, the time is up. And of course, the answer is Schlein-Flug.
Last two questions coming up. Do or die situation. Over to you, Vardhaman.
Thank you, sir. So now this is the last two questions to go. And what is this probable diagnosis? You can see this is a tomography done by serous tomography. And what is the probable diagnosis? These things are, options are keratoconus, regular astigmatism, pellucid marginal degeneration, or post-LASIK ectasia. So, sir, can we go back to the slide?
Sure.
For them? Yes, thank you. So just look at this slide and tell us which is the probable diagnosis. It's a very classic appearance that you see. Is it keratoconus, PMD, regular astigmatism, or post-LASIK ectasia? Okay, the time is up. So let's see how many people have got it right. This is 72%, which is vast majority, which is good. So this is a very classic, what is called as a kissing bird sign or a crab claw appearance, where you actually see these two things going against the rule. Yes. So basically, this is what is very classic feature of PMD, pellucid marginal degeneration. Yes. So now we'll go to the last two questions. Oh, last question now, actually.
Last question.
This is the last question. And it is a nice clinical question for you, which is a 22-year-old patient who underwent LASIK. He presented back on the day 5 with blurriness of vision, and vision had dropped to 6/24. And when the intraocular pressure were checked, they came to about 24. What is the most probable diagnosis? You can look at the picture of this patient. He is post-LASIK, day 5. Is it flap displacement, DLK, central toxic keratopathy, or a pressure-induced stromal keratitis? So what is this classic picture? You do see this sometime, especially for people who are high myopes, where you do LASIK procedure on them. So basically, now we will have to see for the last answer how many people get it right. Is this flap displacement, DLK, CTK, or PISC? So the poll is locked and the answer is PISC. And I think vast majority of them have got it, which is wonderful, because pressure-induced stromal keratitis is a very classic thing that you see in people who are steroid responders. Post-LASIK surgery typically peaks in the first 1 week's time. And it is a very close differential diagnosis for DLK, because clinically it looks like one, but your IOP is high. And if you do a nice OCT, anterior segment OCT on this patient, you will see a nice clear fluid pocket between the flap and the underlying stroma, which is called as the interface fluid syndrome. You can see similar picture also post-smile as well, or after any lamellar surgery. So again, we come to the end of this wonderful MOS quiz, which was the 5th league. And again, both me and Dr. Bide sir would like to thank MOS, Dr. Dr. Taswala sir, our dynamic president, Dr. Rajesh, who is our secretary, for giving us this wonderful opportunity. And we hope that the best wins this
Thanks, Vardhaman, and thanks, Santosh, for conducting it so nicely.
Yeah,
we are
thank you
awaiting
so
the
much.
results
That was
usually
really
on
wonderful.
Slido. We get it very fast within the next 5 minutes. In the
Great.
meantime, I would just like to ask, are all the participants the MOS members? If they are not, and if you are going to win the prizes, I would definitely like you to become the MOS member to claim the prize. So that is the first which we have already declared during the quiz itself. So I'm sure We wish everybody the best of luck, and the issue is,
already the results are declared.
yeah. So we
And
have
the first
it
one is Jayaprasad B, and he has, sorry, the.
Can we have them upgraded on the panel, this thing, as panelists?
Sorry, the first one is Kaushik Tripathi.
Last time also he was winner.
Kaushik Tripathi, and he has answered 36 questions correctly. And he was quite quick also. He answered it, average speed was 3.56 seconds. So kudos to Kaushik. I think Professor Rajesh ka student hai kya wo?
No, he has won last time also.
I think he is one last time also. He won't be eligible for prize, but definitely for the final.
Winner for
Congratulations, Dr. Kaushik. Well done. The second one is Jayaprasad B.
Bhaskaran,
and he has answered 33 correct out of 40, and speed is 5 seconds and 5.18. The third one is Sarat, and he has answered 31 questions correctly with average speed of 4.56 seconds. So congratulations to all the winners.
Now we have Saudamani. Listen, Dr. Santosh, Kaushik is already not eligible, though he has won. We congratulate him, but he will be definitely in the finals. So we have Saudamani.
We have Saudamani,
yeah. 31 out of 40 at a speed of 5.02 per seconds is the fastest figure. Arthi 1KD, 30 out of 40 at the speed of 4.55. So can we upgrade them as panelists? I would like to ask them some questions.
I can see Sarat here.
Sarat,
they've already done.
I can see you.
Jayaprasad Bhaskaran also I can see. Congratulations, Jayaprasad. Congratulations, Sarat.
Congratulations, everybody who has won today.
Congratulations, all the participants also.
Wonderful.
In fact, everybody has given a very good.
To all the participants who have participated. Very true.
Sai, can we have Saudamani and Arti 1KD also?
Yes. And
they're already there.
This is the best way of learning. Quiz is the best way of learning. And it's an interesting way of learning.
It's the passion with each one of you who have taken time out, even at the late time. Yes. You have participated. That itself shows that you have a passion. And of course, intelligent enough to win. Hi, Dr. Arti, Dr. Sarat, and Dr. Jayaprasad. Hearty congratulations to three of you. And I think Dr. Saudamani is also there. Sai, can you upgrade him?
I've already done that. Doctor.
Arti 1KD.
Arti ne, Dr. Saudamani, number 4. Kaushik, he is already won. I think all the quizzes is there in the first 4. So congratulations, Kaushik. Unmute yourself.
Thank you so much. And say something.
You have become a regular winner, boss. बाकी लोग को भी चांस दो, इसलिए हमने वो रूल रखा है.
He's going to win more in AIOC. He's going to win more in AIOC.
Yes. So you
best of luck to
chances of
all the winners and all the participants.
Also in the finals that we are going to have in MOSCON. So keep your fingers crossed and prepare for that. Dr. Arti, Dr. Jayaprasad, and Dr. Sarant, are you MOS members?
Yes.
No, if you are not, please share your mobile number. Dr. Rajesh Joshi will contact you. And of course, we have got some prizes to win. So if you become the MOS members, you definitely will be eligible to claim the prizes also. I'm sure with so many activities going on in MOS, you'll love to become the MOS members, right? Dr. Jayaprasad?
Look forward to that.
Sorry?
I'm looking forward to that. Joining.
Oh, so nice of you. What about Arti? You are there, I think.
Arti,
yes, I am a member.
Yes,
Saran. Then what about Saudamini? I can see the name of Saudamini also.
Yeah, promoted, but she refused to come online.
Okay, I think the winners can say a few words. Maybe they can introduce
I would just
themselves.
like to ask, how did you like the quiz? Any changes you'd like to have? Only sorry for the delay because we are having on 2 platforms. One is the Zoom and one is the Slido. So to have it integrated, it takes a little time. So feedback from each one of you. Jayaprasad, you start first.
They can introduce themselves. They are from which place? They should introduce
Trivandrum, Kerala.
Very nice. Excellent.
Yeah, I'm from Trivandrum. I'm in private practice. And this is basically an experience for me, learning actually. Something like
Learning also.
what I have learned all these years.
Yeah.
So it's very nice actually.
Any improvement you would like to have, a little different type of questions,
No, if the
whatever it
Slido
is,
link, if the
give a
Slido
critical
link can
feedback.
also
We
be
want to change.
included. Sir,
Sorry,
if
go again.
the Slido link can also be included in the first email, then I think more people will join as soon as we say 9:30. People will be able to join in.
Right.
If both are
Right.
there in that email.
Right, we'll keep it in mind. Sai, our technical head, is already there. He's also listening. Sarah, over to you. Can you introduce yourself? Where are you from? How many years you've been practicing?
Okay, actually, I'm from Kerala. I'm working as a senior resident in RP Center AIMS.
Oh, that's
Okay.
very nice. That's very nice.
What specialty are you doing? Your senior
And what's,
I'm doing cornea, cataract, and refractive surgery.
Okay. All right.
okay. And did you love the quiz, or it was the rigmarole regular
sir.
quiz?
Yes, sir. I just attended this time. It was good only.
Quite right, quite right. And Aarti, what about you? Enjoyed it? Unmute yourself, please. Where are you from?
I am currently working as a senior resident in GMC Nagpur. I'm from Maharashtra.
So we have Dr. Rajesh Joshi as
Dr.
the
Rajesh
professor.
is your sir.
So no wonder we have one of the contestants who is from GMC. Kaushik, where are you from? Just introduce again. Let the other people also know. Unmute yourself.
Sir, I am from Kolkata. I am a data consultant. I have done senior residency in
Unable to hear you. There is a lot of cracking of your noise, boss. Go again.
Sir, I am from RP Center AIMS. Actually, I am a retina consultant practicing in Kolkata.
Okay, AIMS. So no wonder. So we had a wonderful winners here. You shared your this thing also, whether you liked it or not, and any improvements. Definitely we'll put it in mind about the Slido. What Mr. Jaiprashad has said. Those who have not MOS members, please share your mobile numbers on the chat. Dr. Rajesh Joshi will note down. He'll contact you. We'll make you MOS members, and then you'll be getting your prizes. There'll be surprise prizes, very pleasant and very good. You'll be liking it. Don't worry. So, can you share your numbers, please? Your mobile numbers.
Can share them in chat box.
Dr. Saran.
Yeah, sure.
Kaushik, तुम्हारा तो है ना already?
Yes, sir. Applied for MOS membership. And sir, one more suggestion that
Dr.
time
Kaushik is
given
a
for
member.
the time given
MOS
for the
member.
answer should be reduced because everybody uses Google now. Just a suggestion.
What is the suggestion? Please
He
go
says
ahead.
that actually the time should be reduced because people
Time
can
should
even
be
Google.
Yeah.
Okay.
Yes, and also to increase image-based questions, like show only an image and ask what is this or how will you manage. That checks for skill also.
No option should be given. You mean no option should be given?
No, give options, but just show the image. Show image of a classical condition and then ask what is this or how do you manage this.
Yeah, I think we'll have to reduce your time because there is sufficient time to Google and quickly find out on another device.
I think we have
So that's
20.
a good suggestion,
15,
Kaushik.
15 is
Well
fine.
taken.
Yeah, 15 is fine, I think. Yeah, 15 seconds
We
is
had
okay.
15, but
yeah.
the questions were long, options were to be read out. But now, after reading all the options, we'll keep about 10 or 15 seconds. So, point well taken. Thank you, Kaushik, for your suggestion.
Fine. 15 is fine.
And a big thank you, all of you, for joining. I think we'll have more of it. Every month we are having it. Please do join. Those who have not won also, please join. And those who have won, thank you very much. You'll get definitely chances in the finals that we are having at MOSCON, which is going to be held on 14th, 15th, and 16th at Nasik. Your physical presence is what is required there because there we won't be having a virtual thing. So pack up your bags and be ready for that. So thanks, Dr. Santosh.
And
Dr.
see you
Vardhaman.
next time in Mumbai, sir.
Yeah, we are
See you
seeing
next time,
everybody.
next
Each
week
one
in
of you at
Mumbai.
AIOC. I hope everybody
Yeah,
has registered.
definitely.
Everybody
Yeah.
has
Meet in
registered for the
AIOC.
DreamCon. If you're not, please do. I am joining on first, the pre-conference day itself.
Okay.
So,
See you then, sir.
Yeah.
Looking forward to meeting all of you. Thank you.
Good.
Thanks a ton.
And
once
do
again,
register for MOSCON also. There will be a
That
stall.
will do it. Yeah.
And
those who have not registered for MOSCON, I think it is available mosi.org. Directly, there is a link available. Please do. It will be a very interesting conference. We'll have a lot of things. This year we have had a lot of activities. This is the 100th event. Lucky that you are there on the 100th event. Maybe during the finals, we'll have a lot of new activities which I have worked up for the conference also. So you are definitely going to enjoy it. It will be one of its kind. So do join. Thank you very much, Dr. Santosh Bede, Dr. Vardhaman Kankaria, Dr. Rajesh Joshi, all the contestants, all the winners, and of course, Sai, for your good backup. Please make a note of all the suggestions which have come up. I think we'll do implement it. Right?
Sure, doctor.
Thank you, sir.
Thanks a lot.
Thank you, everyone.
Rajesh, सगळ्यांचे note down कर ज्यांचे numbers आहेत ते and follow it up, please. Make them
Oh,
the members.
definitely.
Yeah. I think, Sai, you have already noted down the cell number and all while registering itself, right?
Yeah, he must be having leaderboard.
Yeah, I've already taken it.
Ah, so fine. Otherwise, also, I think we'll do it. Chalo, take care. Good night, everybody.
Good night.
Thanks a lot.
Good night.
Thank you.
Thank
Thank
you.
you.
Good night.